On March 11, 2020, Hamilton recorded its first case of COVID-19. It was a Juravinski cancer doctor who had just returned from Hawaii. At that time, other patients were not overly concerned.
Everything's under control. And if there's a doctor, then they know what to do. They'll take care of it as far as I'm concerned.
But that same day, the World Health Organization declared the coronavirus a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
2 weeks later, non-essential businesses were ordered to close and everyone was expected to work from home if they could.
Enough is enough. Go home and stay home.
What happened 3 days ago versus a week ago versus today, this is changing absolutely rapidly, hour by hour, and we have to react as it changes.
March break was extended and eventually the kids finished their classes online. But by summer, restrictions started to ease and people started trying to resume normal life. This public health graphic shows the virus growth in Canada over the past year, with the most dramatic jump beginning last fall with the second wave.
We're at a tipping point in this pandemic.
Then Ontario came out with a new system of allowing certain activities depending on the severity of the virus in a given area.
This means gyms and indoor dining will be open with the capacity limits and restricted hours.
A year later, COVID-19 has morphed into several virus variants, even more transmissible than the original. But at the same time, Canada has approved 4 separate vaccines that are proving effective.
And the great news is someone in Ontario will receive the 1 million dose today.
Lisa Hepfner, CHCH News.